A Lethbridge-based cardiologist and medical director of Chinook Cardiology is embarking on a new role. Dr. Sayeh Zielke was recently named the interim CEO of Assisted Living Alberta. The new agency will provide Albertans with what the government calls a comprehensive system of continuing care with a range of wraparound services. Dr. Zielke joins us now to talk about this new role. Thanks for joining us.
Thank you so much, Paul. It's a pleasure to be here today.
Yeah, always good to have you with us. You've served in a variety of roles with Alberta Health Services over the years. So what drew you to this role specifically?
Um, I was asked in December to chair the transition committee that was tasked with identifying strategies, pillars, and direction for assisted living Alberta as one of the new provincial health agencies. Minister Nixon had asked me to consider that role, and I had said yes because I felt like it was exciting. It is not my subject matter expertise as a cardiologist, but I do have enough interplay or interactions with that sector through my patients that I take care of, and I felt that it was an opportunity to serve. So I stepped in that role in December as a chair of the transition committee for assisted living Alberta. And as the organization became a legal entity in April, there was a need for an interim CEO role until one was recruited to the permanent position. So my position evolved or morphed into the interim CEO role, which I have had the pleasure to serve in since April 8th.
Okay. How long do you think it'll take? There's a transition period, so how long do you think you'll be there at the interim role?
So far, I have committed until August, pending a successful recruitment and onboarding of a new permanent CEO.
Okay. All right. Well, Alberta's population, we're certainly aging. When I look in the mirror, I see that, just over
Cutting
800,000.
old, Paul.
I'm getting close, Just over 800,000 seniors living in our province, and about 2,500 Albertans turn 65 every month. So by 2046, 1 in 5, 20% of Albertans will be seniors. So with that in mind, what are some of the most pressing needs that Assisted Living Alberta will have to address?
Yeah, there are a few. One of the most important ones is ensuring that we are providing adequate, excellent care for our seniors to age with dignity in the place where they call home, whatever that may be, whatever that may look like, to be able to provide support in that space. Very importantly, right now, unfortunately, about 75% of our seniors enter the continuing care system through admission from acute care. So they are admitted to the hospitals, are waitlisted for continuing care, and then they're transferred to the continuing care facilities. And there's a delay that is experienced by the patients and the clients while they're waiting for that transfer, which is not ideal. We are taking up acute care beds for someone that needs access to those services, someone who's waiting for colorectal surgery or breast cancer surgery, and on and on. It contributes to the wait times to the emergency department, but also it's not ideal for the client or the patient to be waiting in acute care when they need to be finding a new home. Every day that they spend in acute care is potentially a risk to their health in terms of deconditioning, not getting the services that they need, not to be up and moving, but also, as you can imagine, there's a risk of infection being in acute care as well. So it is our focus and priority to be able to work on creating extra capacity so individuals can move into continuing care quickly and easily, and also working with acute care partners and AHS in shortening the assessment time so patients are not waiting in acute care beds for continuing care facilities.
Yeah, we went through that with my parents. They've since passed on, but yeah, I remember how frustrating that was. They're stuck like you say, in acute care, and there's just no places available. So definitely something that needs to be addressed for sure. Now, Assisted Living Alberta, newly formed to provide what is being called wraparound services, quote unquote. Can you explain, what exactly is a wraparound service, and how is this going to impact the senior population?
Yeah, for sure. So, the aim and the goal of assisted living Alberta is to marry medical services with social services together to provide care for seniors as well as the vulnerable population and the individuals with disability, and to be a one stop shop for all those services. So, whether that is a senior or their family wanting to access someone's help for moving a fridge, or uh, going into or finding a space in a continuing care or assisted living space. We want to be able to provide that spectrum of care through the use of technology, all embedded in one organization. Because as you have heard the saying, where um, focus goes, energy flows, and traditionally, this sector has had to compete with other priorities in the healthcare system, so it's really exciting to be able to have our own minister, our own ministry, our own organization, and a vision to be able to truly concentrate on providing a range of services for the seniors in our population, in our community, as well as those individuals and clients in need.
Is there going to be any specific? You mentioned, technology, being used more so for this. Is there any specific kind of technology that's going to be put to use to find the right places for the seniors?
Yeah, absolutely. So right now we are the team is very much hard at work at establishing a portal system, so a digital tool whereby we would be able to see the capacity in the continuing care sector in the system. That is now online as of last week in its early stages in a pilot form. We hope to layer upon that the need and the demand in the system for the continuing care beds. We plan to introduce some of the services that will be provided under ALA so that this portal will become a one stop shop. So
Okay.
people can access the portal, the users, the care providers, as well as our stakeholders and those that provide the services all under one umbrella.
Okay, yeah. Hopefully it'll be very user friendly and easy to tap into. Now you were chair of the transition committee. You mentioned that earlier. That was tasked with roundtable discussions with care providers themselves. So, what did you hear from the care providers? And are these consultations something that's going to keep on going down the road?
So it was an incredible opportunity to learn from the subject matter experts in this space. So we had representatives from the different continuing care organizations, from the disability sector, physicians, all come together and provide some direction and input as to what ALA should look like. Very importantly, we also had community and patient representation in the committee as well. We took that information, but we also augmented this information and validated it by doing roundtable and stakeholder engagement, as well as a public survey and a surveying as well the AHS staff and interacting with them to be able to get all this feedback all together to provide a direction for this brand new organization to truly provide the best care that we can in this sector, because this is the first time in Alberta that again we've been able to focus on our senior care the way that we are right now, and it's a very exciting opportunity, and we can only get it right by tapping into the expertise of our stakeholders, our partners, our community, our patients and clients and their family.
Right. And is this going to keep on going as well, like down the months ahead and so forth?
Right now, we are in the process of wrapping up the first round of
Okay.
engagement that we did, then the input, by having a public page facing report that will be hopefully be published in the fall for
Mhm.
everyone for individuals to read and digest. And I'm sure we will create further places where people can provide input and direction as we move on through this transition period.
Yeah, I think it's important to always keep that ear, that opportunity for people to speak into the situation as they experience the changes, right? And is there anything really specific that jumps out at you that, is consistently you're hearing back from the various caregivers, this needs to change, that needs to change? Is there anything that's kind of overwhelmingly, yes, this needs to be priority sort of thing, or?
I think capacity, wait time, the interaction with acute care, waiting in the hospital, not being quite sure who or where to go, not having one direct point of contact, all of that have come up consistently.
Okay. So this redesign of Alberta Health Services into 4 new sectors has certainly created some controversy. Now, the government believes this will address the inefficiencies, but what do you say to the critics who claim this is just the government inching towards more private health care? Any thoughts on that?
Yeah, so obviously I haven't been part of those decisions. The way that I see it from where I'm standing, again, is that this is our opportunity to be able to provide focus, clarity, precision to the continuing care and seniors care space where it has been lacking in the past. Ontario made a similar change, and the continuing care ministry evolved to be its own standalone ministry, and they have had quite a bit of success by doing so. So from where I'm standing for the work that I have been tasked to do right now, I appreciate being able to have the focus and the exact direction and the support to make it happen. Of course, I come from an acute care background myself as a cardiologist, but when you have the different specialties and the different priorities in the healthcare system around the table, there's a little bit of course, like you're competing for the oxygen in the room. So to be able to carve out something that you can focus on, I find that a really great opportunity to change the system for better.
Right. And of course, I guess, and I don't want to throw you into the political realm here, private healthcare or not private healthcare, but we should probably clarify, and as we're seeing in Ontario as well, this is not citizens paying out of their, pocket. You've got to reach into your wallet sort of thing. This is actually still funded by taxpayer dollars. So the government is actually footing the bill on this, correct? So,
100%. That
yeah,
has been
yeah.
all of the work that we have been doing has been to ensure that no one is left behind, that we're providing the most excellent care that we can imagine for all members of our community.
You bet. Okay. Well, maybe let's just wrap it up here, I guess, again with, what would you say, Dr. Zielke, is your number one priority in this new interim role?
To be able to communicate the vision of Assisted Living Alberta and who we are, the new organization, to be able to open and keep open the lines of communication and dialogue with our staff that are transitioning over, with our clients and with our stakeholders, be humble. Be willing to listen and learn and try our best to get this right for our people because we are all in it for that reason.
Yeah, we want to basically make sure that our elderly population is taken care of, that there's enough capacity there, enough room for them to go, with dignity into the next, years of their life and being well cared for. So, yeah. Well, thank you for, all the time you're sinking into this. Appreciate it, Dr. Zielke.
It's been a privilege. Thank you so much, Paul, for your time.
You bet. Dr. Sayeh Zielke, a Lethbridge cardiologist and the medical director of Chinook Cardiology, as well as the interim CEO of Assisted Living Alberta.